Obstructive sleep apnea is a common and likely underdiagnosed sleep disorder that involves either breathing pauses or decreased airflow while breathing during sleep. The tongue, soft palate, and throat tissues relax or collapse, which leads to this breathing obstruction. These breathing pauses can sometimes be 10 seconds or longer, and this can result in a decrease in your blood oxygen level, which harms organs such as your brain and heart. Untreated sleep apnea can affect every aspect of your health and well-being. During sleep, it can cause things such as loud snoring, restless sleep, having to get up multiple times to go to the restroom, and just generally feeling very groggy even if you get a full 7 or 8 hours of sleep. Not only can this be disruptive for you, it can also be very disruptive for your bed partner. There's several different treatments for obstructive sleep apnea. The classic gold standard treatment is CPAP, or continuous positive airway pressure. CPAP works great if you can tolerate it, and it's about 50% of my patients who tolerate CPAP. For some patients, CPAP causes too much discomfort or skin irritation or a feeling of fullness in their stomach, and it's just not something that they can commit to using every night. For those patients, there are several other treatment options. If you have more mild to moderate obstructive sleep apnea, something like an oral appliance can be very helpful. This is something you would usually get from a dentist that can keep your jaw forward and keep your airway open while sleeping. Again, this works great for some people, but for many, it can cause pain and tenderness in the jaw, and it can change the way that your teeth fit together, and so this is not a great long-term option for many patients. If these more conservative treatment options fail, there are multiple surgical options for obstructive sleep apnea. A lot of these surgical options involve things like removing the tonsils, reducing the volume of the back of the tongue, or even trimming the soft palate. For certain patients, these surgeries can be very effective and are a great second line of therapy. However, for many patients, their anatomy is such that they're just not a good candidate for these surgeries, and it may not be effective. In addition, these surgeries are often very painful and can take a long time to heal from. There is now a newer, more advanced surgical treatment that is very effective for many patients with moderate to severe obstructive sleep apnea who have tried CPAP and have not been able to tolerate it. This is called the Inspire hypoglossal nerve stimulator. The Inspire device is implanted during a safe outpatient surgery that usually takes about 1 to 2 hours. There are 2 incisions, one in the top part of your chest and one in the upper part of your neck. An implant is placed on the chest muscle. Underneath this implant is also a sensor that detects your breathing while you're sleeping. A nerve stimulator is then placed on the nerve that controls your tongue muscle. After the implant is finished, the device is tested to make sure that everything is functioning properly before you even wake up. You're discharged the same day of the surgery in most cases. You follow up for a quick post-op visit in about a week, and then the device is activated 1 month after the surgery. After the device is activated, you simply use a wireless remote to turn on the device and you go to sleep. Every time you take a breath, a signal is sent to the tongue muscle, which prevents it from collapsing and causing airway obstruction. When you wake up, you use the wireless remote to turn off the device. That's it. So if you've tried CPAP and it isn't for you, or if you think you may have sleep apnea and just aren't sure, call us to make an appointment with one of our board-certified ear, nose, and throat physicians.